Good afternoon, Is it on? Do I need it on here? Yeah? Okay. Good afternoon, everybody. It still works. I used that when I was caucus chairman of the Republican caucus. That's how I got the boys to be quiet. And it still works. That's the only kind of whistle I can do. It doesn't come out any other way. It is effective. Okay, we're running a little bit late because of the rain and people getting over here. It's nice to see that there's some actually empty seats, because usually it's standing room only. So I will call this meeting of the House and Human Services Committee together, and we are ready to go now. Representative Silcox, I think that you have some group you want to recognize, and you are recognized to do that at this time.
Thank you, Madam Chair. Anyway, I've got a group of future farmers that are here to watch the legislative process. John Hagan and his wife are the advisors, and Mary Beth is the young farmer secretary, and the leadership, and I won't mention them by name because I already have in the House, but I would like for y'all to stand up so we could recognize y'all here in the committee. And as I was talking with Madam Chair earlier, this is where the rubber meets the road in the committee work. Once it makes it to the House floor for a vote, the hard work has already been done. So this is where you actually see the legislative process in action. But anyway, thank you, Madam Chair, and thanks, guys, for coming up.
All right, thank you, girls. As I said to you, I grew up in a small town in Texas, and we had your organization in my small school. I didn't participate on official business because my father brought home every orphan that he had on his farms, and we took care of it in the kitchen washroom, in the washroom outside the kitchen. So, and we even had a monkey come to live with us. A spider monkey came to live with our dog, and gave us many hours of entertainment. One of my classmates, out of my 22 numbered graduating class, 22, became a vet. The monkey on one cold Texas day got up under the car when my dad had drove in to try to get warm on the motor, and my sister started it up and soon after and broke the monkey's arm. My younger sisters cried the next morning because Daddy wasn't going to do anything, so they took the monkey to the vet, and the vet put a cast on the monkey's arm. And at that point, the monkey couldn't pick up its arm off the exam table. It was the first monkey the vet had ever treated. So, needless to say, he took the cast off, put an ace bandage around the monkey's broken arm, and charged my father $75 practically on his deathbed. He was discussing how terrible that was, and he paid $75 for a monkey. So I grew up in rural Texas, and I appreciate what y'all do and how it fosters leadership. So thank you very much for being participants in that. Okay, now into serious things. I was trying to get myself in a better mood. We've said this before. All of you that are lobbyists, do not, everybody listening? Do not come to me 30 minutes before we come over here and tell me that you have problems with a bill and that you haven't spoken to the person that is authoring the bill. These bills weren't dropped yesterday. Now, when it gets close to crossover day, there could be one that's dropped a couple of days earlier, and it could be that way, but that's the exception to the rule. These bills have been sitting out there. The authors of these bills were willing to talk to you. My door has been open. Several people and lobbyists have come to me on other issues, and I'm setting up groups to try to iron out their differences. But don't come to me at the last minute and tell me that you have problems with a representative's bill that's going to be presented in this committee today. And the same goes if you're here representing a department. Do not do the same thing to me. These bills are out there. The authors will talk to you, and I will talk to you, but not at the last minute. Now, I don't think I should have to say that again. For lobbyists, you're getting the big bucks to represent your clients. Do your work. And for the state people, you're getting paid better than we're getting paid to do your job, so do it. So with that, we will move on. Okay, and on our agenda, House Bill 158. Representative Silcox, you want to go first? And just as an afterthought, I don't keep banker's hours. I was here till 7:30 last night. If somebody had come to me, I would have stayed till 8 or 8:30. So I'll just add that to the addendum. Okay.
Thank you so much, Madam Chair. I appreciate that, and I'm glad I didn't come to you 30 minutes ago.
Good idea. It wasn't pleasant.
I come to y'all today with House Bill 158, and I will say first of all that you may not be aware, but Georgia is actually #1 in the nation for the number of HIV cases, new cases per year. In 2016, and there is a sheet in your folder about this, in 2016, for example, there were approximately 35,402 people in the metro Atlanta area living with HIV. Approximately 1,513 of those were brand new diagnoses. There are currently approximately 3,500 to 4,500 people on Medicaid currently in Georgia with HIV. This law is needed because eligibility for the Georgia AIDS Drug Assistance Program, or ADAP, is not the same. It's very comparable, but it is not the same as Medicaid. This is largely due to the fact that ADAP and Medicaid only review these formularies once a year, and these drugs are either brand new drugs that haven't been approved, or they may be old drugs that were previously reviewed and rejected by those bodies. The key to management of HIV is compliance, because unless a patient takes their drugs for HIV every single day, they are not virally suppressed, the virus reproduces itself, and they can infect other people. And that's why I've specified in the bill that a single tablet regimen is so important. Evidence shows overwhelmingly that if someone is only required to take a pill once a day, that their compliance is much, much better than if they have to take multiple pills over multiple times per day. Each new patient costs Medicaid approximately $338,000 for HIV medications, but this is far, far less than the $1.79 million for a patient that is not virally suppressed. The average annual cost of treatment for one of these patients is $24,256. Patients with HIV complications do cost more than people without HIV, because if they are admitted to a hospital or a healthcare facility, there have to be special accommodations made for those folks. This bill will allow physicians to get patients into treatment quickly with the very most effective drug regimen possible. So I think this is a very fiscally responsible way and a very humane way to take care of these people around us.
To summarize, you are saying that HIV patients are treated on Medicaid,
Yes.
correct?
Yes.
So it's not starting anything new. They are entitled to treatment on Medicaid if they qualify for the Medicaid.
That's correct.
And are you saying that we, as a rule on our Medicaid program, require them to take multiple?
Presently, there are different regimens. There are single tablet regimens already out there, but some people are on a multiple tablet regimen, and this is not to say if that is what's working for them that they would be required to switch. It's just to say that this is what it's encouraged going forward because the compliance is so much greater.
Okay, questions from the committee? Representative Hawkins.
What's the cost difference on the multi-regimen versus a single dose?
It's actually less expensive on the single dose.
Oh, okay.
Okay. Other questions? Okay. Do we have any, we didn't put a sign-up sheet, do we have anybody from the audience that is compelled to speak on the bill? Okay, not seeing anybody. What's the will of the committee? Okay, we have a motion to pass with a second. Is there any further discussion? Any of our committee members that want to ask questions or discuss it further? Okay, we have a motion of do pass on House Bill 158. Everyone in favor, say aye. Anyone opposed? I think the ayes have it, Representative Silcox.
Thank you very much.